Welcome back. Welcome back. This is the People's Voice. I am Trey Evans, and I am the People's Voice. Thank you again for checking out the podcast this week. As always, it is greatly appreciated. As always, we thank everyone who has taken some time to listen to the podcast today. We do understand that you could be utilizing your time to do something else, so we are appreciative of you taking that time to spend with us. As always, if you feel this information is impactful, enlightening, and valuable and worth sharing, we ask that you subscribe and turn on notifications to the podcast or for the podcast. That way you'll be notified when each episode is released. We do put out a new episode each and every Friday, which is heard on all podcast platforms. And then we put a video out on YouTube every Wednesday as well for those who like to watch the podcast. But in any event, we say welcome and welcome to the People's Voice podcast. So today I want to revisit, if you will, something that I've brought up that I did last year, around pretty much almost the same time. And last year I did a podcast about medical debt here in the United States. And I want to talk about this today because recently there was a bill that was passed earlier this summer, in North Carolina, that is aimed to address some of the issues and challenges that many people in America, in the United States, are dealing with when it comes to medical debt. So that's what I'm going to cover today. I'm going to cover medical debt and then also talk about this bill that was recently passed here in North Carolina. So for those who don't know, and those who watch the YouTube of this podcast, I will put the video somewhere in here as I'm talking. But last year, like I said, I talked about this in terms of the amount of citizens that are struggling, or not just struggling, but owe medical debt here in the United States. Now, you know, the argument always is the United States is one of the most advanced societies in the world, and yada, 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 yada. But, you know, one of the things that is a constant challenge is, first, access to quality health care, but that's a different subject. But then secondly, access to affordable health care. And, affordable health care is something that is continuously getting beyond the grasp of so many citizens in this country, which is leading to more and more debt. I mean, you constantly hear when the debt conversation comes up here in the United States, people want to talk about student loan debt, credit card debt. Then they'll get into, maybe car loans and mortgage debt, things of that nature. But, medical debt is one of the leading debt categories here in the United States. And so recently, like I said, a bill was passed in North Carolina, and that goes into effect, I believe, early next year, that will help to hopefully relieve some people who have struggled with medical debt. Now, it's estimated, and I'm reading the article, and this article is a couple of years old at this point, but the numbers haven't changed much. This is from CNBC. It's estimated that over 100 million adults here in the United States, over 100 million adults here in the United States have some form of healthcare debt. And, again, this number that they're quoting here is from a couple of years ago, but at the time it said over 12% of those out of that 100 million owe well over $10,000 in medical debt. And so when you see that number, staggering enough just by itself, but then when you start to put it into context, right, because there's only 50 million Americans here in the United States in terms of identified individuals. And so if 100 million have some form of healthcare debt, I mean, that is definitely an alarm, that needs to be sounded. But again, like I said, for some reason, that conversation kind of never gets, it's not sustained. It's almost like it's accepting, like, yeah, well, you're going to have medical debt, and it shouldn't be that way. But going into this bill, so this bill that looks like it went into effect in July, and I'm looking for the name of this bill. But in any event, there's an article here that was done by the Kaiser Family Foundation where they kind of laid this out. And the bill is estimated to basically relieve up to about $4 billion, it says here, in existing medical debt for nearly 2 million people. And hopefully it's going to implement policies in the future that help to prevent future medical debt for North Carolinians. Now, here's the thing. I believe this is like one of the first in the country. And, one of the reasons why this is because North Carolina for years has led in terms of states with the most medical debt. North Carolina has led all states for a number of years. So, the fact that this is happening, for North Carolina is a big deal. Not only that, but I'm sure this also sets a precedent with other states that can now look at their totals in terms of debt, medical debt for their citizens, their residents, and then go on from there. As I was talking, I was trying to find that stat about medical debt because, and specifically in North Carolina, because it was wild when I read that, and I'm trying to see it as I'm talking here. But like I said, medical debt in North Carolina has been a problem for quite some time. But going back to the bill, so this bill, like I said, it passed, I guess, North Carolina State House in July, and in that there are a few provisions that it will cover in order to relieve some of that medical debt. Here it is. I was reading it. It was right in front of me. So here on this same article from the Kaiser Family Foundation, it talks about North Carolina in terms of the amount of debt. It says North Carolina was among the states with the highest reported share of adults with a medical debt in 2019 and 2021. And that was 13.4% of the adults in that state had some form of medical debt. It says the share of adults with medical debt varies considerably across the U.S., which I kind of just pointed out. But it says here the share of adults with medical debt is likely higher in the South because 7 states in the South have not adapted ACA Medicaid expansion. That's Obamacare. The region was higher in uninsured rates compared to other regions. It then goes on to say in December 2023, North Carolina became the latest state to implement the expansion, reducing the number of low-income uninsured people without access to Medicaid. So, a lot of this debt that is listed here was a result of North Carolina and other states not wanting to adapt Obamacare. But in any event, North Carolina was leading in terms of states with the most of medical debt. But getting to the bill, so the bill itself, it's going to do a few things. First of all, it's supposed to help relieve all unpaid debt dating back to just January 1st of 2014, because I think that's when Medicaid was expanded. That would have been under Obama, I believe. But so basically, it'll relieve all unpaid debt dating back to January 1st, 2014, owed by current Medicaid enrollees. And now some people might say, well, yeah, only 10 years. Well, 10 years going back, that's a long time to have any type of debt, unless it's a house or something. But medical debt, that's pretty insane. Relieve all medical debt deemed uncollectible dating back to January 1st, 2014. It'll also, for any individual not enrolled in Medicaid with incomes at or below 350% of the federal poverty level, it will forgive debt for those individuals, and basically that would be equated to $90,000 of income for a family of three in 2024, which is tough to say the least. And then for any individual whose debt exceeds 5% of their annual income. For any individuals who total debt exceeds 5% of their annual income. So, wow. So if you making 90,000 and basically your debt is 95,000 or 100,000, then they'll forgive the debt for you. But that's insane that it has to be, that amount in order for you to get relief. But hey, it's progress, so we're not going to knock the progress. It goes on to talk about some additional protections. It'll provide discounts on medical bills of between 50 and 100% for patients with incomes at or below 300% of the federal poverty level. It'll also automatically enroll people into financial assistance. But I think here's the most important part of it. And there's some other parts that I also want to talk about this bill as well. It says that under this bill, hospitals basically will not sell the debt of consumers with incomes at or below 300%. It'll also cap interest rates on medical debt at 3% and not reporting a patient's debt covered by these policies to a credit or reporting agency, because that's the key to this, is that oftentimes what happens is these individuals that have this medical debt, it ruins not only obviously that they owe this debt, but they get calls from debt collectors and it goes onto their credit report, and it makes it that much more difficult for them to even, get, just the necessities, buy a car, buy a house, things of that nature. Matter of fact, let me play this piece here from this woman in North Carolina who talked about this very issue in terms of the amount of debt that she's had, and listen to some of the challenges that she goes through when she's getting calls and contacted by some of these debt collectors. So let me play that. This is from WRAL News in North Carolina.
State the go-ahead today.
Lisa Franklin didn't have health insurance when she was diagnosed with a terminal illness. After years of trying, she's finally on Medicaid.
But that doesn't help with the bills that I already have. The credit collectors that are calling me
2, 3, 4 times a day.
Franklin is one of the people Cooper's plan is designed to help. Under his proposal, the state would use extra Medicaid funding as an incentive for hospitals to forgive old uncollected medical debt. If a hospital agrees to participate, it would forgive the debts of people on Medicaid who have unpaid bills from on or after January 1st, 2014, the first date the state could have expanded Medicaid. In Franklin's case, that's tens of thousands of dollars she'll never be able to pay back.
That would be amazing. That would be amazing because right now I'm still dealing with all the credit collectors and
The program would.
And and I just wanted to play that piece, but as you can hear from that one woman, she's still dealing with credit issues and also being harassed. Well, everybody has a job to do, so I don't want to call it harassment, but being contacted by these creditors over these medical payments that she still owes. And it's well over a decade that she's had some of these bills. But as you heard there also in that piece, the plan, although the bill has gone through, hospitals can and do have the right not to accept this money that's coming from these expanded Medicaid payments through the state. So, that's a whole nother topic in terms of this debate. Right now I'm just talking about this bill and what's currently going on in North Carolina. So
all I'm doing is presenting the facts.
I don't want to, go down the rabbit hole in terms of legality and just the moral clause in terms of, why wouldn't a hospital want to accept these payments? Last but not least, there is currently been a bill introduced as of late last year. And this bill was introduced by Democrat in California named Katie Porter, representative, House of Financial Services. And she introduced this bill, and basically the bill would prohibit any consumer reporting agencies from including medical debt on a consumer report. So, your Experian, your Equifax, all these other credit reporting agencies would not be able to list your medical debt on your credit report. Why is this important? Like I said before, when individuals get into medical debt, especially when you start to get into, like I mentioned at the beginning, you have 12, 13% of 100 million out of the 100 million adults that have medical debt. They have balances well over $10,000. That sits on your credit report, throughout the entire period, which when you go to get a home loan, a business loan, or a car loan, it, either you're going to get denied because you have this existing credit, or you're going to, pay a premium in terms of insurance. In terms of interest rates. So there is currently a bill that was introduced. Now, I have not seen it progress any further since this bill was introduced, and this was introduced almost a year ago, in October of 2023. It's called the Medical Debt Relief Act. So, again, as we go into this election season, and I know everybody's, fired up and passionate on both sides about the candidate, please keep in mind that, there are substantial bills that still have not even made it into the House that need to be examined and need to be pushed forth. And this is the time of the year that you start putting that pressure on those who want to be reelected for these positions. Kamala and Trump, that's not even within the the third. It's not. What I'm trying to say is don't get blinded by, the smoke and mirrors. They're going to hit you with the smoke and mirrors, but the real issues that are affecting people, individuals, every single person, is at that local and state level. So you have to be, on point and make sure that you are putting this in front of your representatives to make sure that they are moving these type of bills forward to help with more medical debt relief in more states, and also to help with relieving the constant burden of having these medical debt issues listed on credit reports. But that's what I wanted to talk about today. Like I said, I wanted to get into the conversation surrounding this medical debt that relief that was passed in North Carolina. I think it's a great step in the right direction, and I would like to see more states enact those policies. But if you want to leave a comment, you can reach me on any social media platforms. You can reach us at the People's Voice Podcast on Instagram. You can also reach me at I am Trey Evans on all social media platforms. And then, of course, you guys can reach me on YouTube as well. Leave a comment. We are excited about all of the listeners and the views that we've been getting over the last 6 months. It's been increasing. So we say thank you very much. And we'll continue to do the best we can to give you this type of information. But as always, dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the People's Voice. Tell somebody about the dream. Salute.